गोयात हालीच मणिपालात जाल्ले वास्कोच्या सदाशिवरावाच्या अवयव दानाचे प्रकरण ताजे असतानाच योगायोगान त्याच दिसांनी अवयव दानाचेर पुरुषोत्तम पवार आणि टीमीन मुंबई गोवा पदयात्रा काढली.
In Goa, we found that the place people are ready to donate, but they lack some medical facilities or awareness process. There is only one eye bank in Goa. People do not know where to donate the body. If any person dies due to brain death, there is no facility or no registry in Goa. So if any recipient is there, where he will get? So we thought this place is very proper to make it awareness.
धार्मिक अंधश्रद्धा अवयवदानाचे मोहिमेत आडेना, त्या परस अवयवदानाविषयी खंय जागृतायच कमी आसा. हे टीमीन मोहिमेचेर भोंवतना गोयात वेगवेगळ्या सुवातींनी अवयवदानाविषयी कायदेशीर गजालींची माहिती दिली.
Every religion, they are supporting for organ donation.
A body after death can donate and save about 55 to 56 people's lives and help them to live better.
The hospital should be registered, the doctor should be registered. Now in case of recipient should also get himself registered that he is in requirement of any organ, specific organ, he should mention it. There is a system, states registration, that is SOTO. Above that there is a ROTO. ROTO is a regional. In our region, so in our region is Maharashtra, Goa, Madhya Pradesh, Gujarat, Rajasthan, Goa and Diu Daman.
प्रुडंटा खातीर चेतन गावस.